Dear students, welcome back. In the previous session we have discussed about the stabilizers of the knee, and now in this session we are going to discuss about the patellofemoral joint. As we discuss the role of patella in the discussion of influence, the patellar influence on the quadriceps muscle function, isn't it? And also this patella is a primarily an anatomic pulley and a mechanism to reduce friction between the quadriceps tendon and the femoral condyles, and that the ability of the patella to perform its functions without restricting knee motion is dependent on its ability to slide on the femoral condyles while remaining seated between them. Okay, so these are the main functions of the patella during the knee joint motions. Okay, now we will discuss about now the patellofemoral joint, which includes the patellofemoral articulating surfaces and also the patellofemoral joint congruence, and we also discuss about this patellar motions. Yes, now we will see first the patellofemoral articular surfaces. Actually, this patella is embedded within the quadriceps muscle. Okay, so this one is the flat triangularly shaped patella, and it is the largest sesamoid bone in the body. Okay, now the triangularly shaped patella is distinguished by being the largest sesamoid bone in the body, together with the femoral condyles on which it sits. The patellofemoral joint is also the least congruent joint in the body. Okay, so although this bone is the largest sesamoid bone, and this bone which sits on the femoral surface appears to be the least congruent joint in the body. Okay, now we will see the articular surfaces. The posterior surface of the patella, okay, the posterior surface of the patella articulates with the central groove or trochlear like groove which is present in front of the femoral condyles. Okay, now we will see the posterior surface of the patella. So the posterior surface of the patella is covered by articular cartilage, and this one is divided into almost equal parts by an vertical ridge, okay, into lateral as well as medial parts. Okay, the ridge may be situated approximately in the center of the patella and dividing the articular surface into approximately equal sized medial and lateral patellar facets. Occasionally, the ridge may be situated slightly towards the medial border of the patella, making the medial facet smaller than the lateral one. So, regardless of the size, the medial and lateral facets are flat, okay, flat to slightly convex side to side, okay, and also top to bottom. At least 30% of the patella also having a second vertical ridge on the medial aspect, okay, towards the medial border, separating the medial facet from an extreme medial edge known as odd facet. Okay, this is called as odd facet of patella. The patellar articulating surface of the femur. So these are here you can find the patellar articulating surface of the femur is in the intercondylar groove or femoral sulcus on the anterior aspect of the distal femur. The groove or sulcus corresponds to the vertical ridge on the patella. So dividing the femoral surface into lateral and medial surfaces. Okay. And the femoral surfaces are concave side to side. The femoral surfaces are concave side to side. Okay. But convex from top to bottom. Convex from top to bottom. Here the lateral facet is slightly more convex than the medial surface and has a more highly developed lip. Here you can find the lateral lip is more developed than the lip on the medial surface. Okay, the angle formed by the medial and lateral facets, that is angle of femoral sulcus, has been found to average 138 degrees but varies widely among individuals, like 116 to 151 degrees. So this is about the articulating surfaces of the patellofemoral joint. Now if you see this, so here we can see this is the patellofemoral joint here. So here this one is the patella is in inverted triangular in shape. Actually this patella is embedded with the quadriceps tendon. Here in this pic you can see the groove, trochlear groove. So that vertical ridge which is present on the posterior aspect of the patella is going to fix into this sulcus. Okay. Now we will see the patellofemoral joint congruence. Okay. In the fully extended knee, the patella lies on the femoral sulcus. So this one is fully extended knee. So here the patella lies on the femoral sulcus. So here the knee joint is flexed. Here it is having some movement towards the upward side. Okay. Yes. Here, because the patella has not yet entered the intercondylar groove, so the joint congruency in this position is minimal, which suggests that there is a greater potential for patellar instability in this fully extended position. Okay, stability of the patella is affected by the vertical position of the patella in the femoral sulcus, because the superior aspect of the femoral sulcus is shallower than the inferior aspect. Okay, the vertical portion of the patella in turn is related to the length of the patellar tendon. Okay, ordinarily the ratio of the length of patellar tendon to the length of the patella is approximately 1:1 ratio. Okay, so and it is referred to as the insal salvity index. A markedly long tendon produces an abnormally high position of the patella on the femoral sulcus known as patella alta. So normally the patella has to fix in this sulcus, but sometimes it may be placed abnormally high position of the patella on the femoral sulcus, then such condition is known as patella alta. Okay, so which increases the risk for patellar instability. Okay, the interaction of the height of the lateral lip of the femoral sulcus with patella alta may also be a factor in patellar instability. Okay, so this is very important. The interaction of the height of the lateral lip of the femoral sulcus with patella alta may also be a factor in patellar instability. In this condition, the lateral lip is not necessarily underdeveloped, but the relatively more superior position of the patella places the patella proximal to the high lateral femoral wall, causes the patella less stable and easier to sublux. Okay. In patients with patella alta, the tibiofemoral joint must be flexed more before the patella translates inferiorly enough to engage the intercondylar notch, okay, or groove. This leaves a larger knee range of motion within which the patella is relatively unstable. Okay, so this is the thing happened in patella alta. So given the incongruence of the patella, the contact between the patella and the femur changes throughout the knee range of motion. Okay, so because of this incongruence of the patella, so the contact between the patella and the femur changes throughout the knee range of motion. So here we can see when the patella sits in the, so here in this pic you can see when the patella sits in the femoral sulcus in the extended knee, only the inferior pole, okay, so this is the inferior pole, only the inferior pole of the patella is making contact with the femur. Okay, as the knee begins to flex, the patella slides down the femur, increasing the surface contact area. Okay, in this manner, the first consistent contact between the patella and femur occurs along the inferior margin of both the medial and lateral facets of the patella at 10 degrees to 20 degrees. So this is the thing. Okay, of knee flexion, 10 to 20 degrees of the knee flexion. As the tibiofemoral flexion progresses, the contact area is going to increase. Okay, this one. Okay, the contact area increases and shifts from the initial inferior location of the patella to a more superior position. As the contact increases, area shifts superiorly along the posterior aspect of the patella. It also spreads outward. To cover the medial and lateral facet. By 90 degrees of knee flexion, all portions of the patella have experienced some contact with the exception of the odd facet. So by 90 degrees, so almost all parts of the patella will have contact. Okay, as flexion continues except the odd facet. As the flexion continues beyond 90 degrees, the area of contact begins to migrate inferiorly once again, as the smaller odd facet, okay, the smaller odd facet makes contact now here, okay, makes contact with the medial femoral condyle for the first time. At full flexion, the patella is lodged in the intracondylar groove and contact is on the lateral and odd facets, with the medial facet completely out of contact. At the full flexion, so the patella is going to contact only at the medial odd facet, not with the medial facet, and it is having some contact on the lateral facet also. So this is the joint. This patella is having different contacts during different range during different degrees of range of motion of the knee. Okay, so this is all about the patellofemoral articular surfaces and the joint incongruence. Now we will see the motions of the patella. Okay, so in the next session. Thank you.